Hello, my name is Dr. Brian Briscoe. I'm a board-certified psychiatrist practicing psychiatry in Louisville, Kentucky. I serve as president and founder of an organization called Kentucky Psychiatric and Mental Health Services. This is an organization that is dedicated to serving persons who struggle with emotional and mental health difficulties. We also serve to educate leaders in the community organizations, churches, pastors, and other organizations about mental health issues. We have particular interest in serving the Christian community. I come from a Christian background myself, and so this is an area of particular interest to me. Now, we do recognize that mental health issues can strike persons no matter what their faith or religious views are. So we certainly do not discriminate against persons who do not share a Christian faith. And at the same time, we want to make extensive efforts to educate the Christian community about these issues and to serve people and their families who are suffering. I'd like to talk a little bit today about panic disorder. So what is panic disorder? Well, in order to answer that question, I first have to explain what a panic attack is. A panic attack occurs when a person experiences an intense and overwhelming period of time during which they experience intense and overwhelming anxiety, fear, and an overwhelming sense of dread. And at the same time, they also experience a number of physical symptoms, and these can include a rapid or racing heartbeat. They feel like their heart's going to beat out of their chest. Or you may feel like you're short of breath. You can feel like the sensation that you're dying, or you can feel the sensation of your body trembling and shaking, or sweating excessively, or feeling just a tingling and sick sensation all over, feeling nauseated, feeling dizzy. There are a variety of other physical symptoms that can occur, and if panic attack isn't diagnosed by the physical symptoms, but just the presence of physical symptoms combined with that overwhelming sense of fear and dread that comes on suddenly. Now, it can be triggered by a variety of things. It can be triggered by crowds, or by driving in a car, or by going to a grocery store, or even just leaving your house. The trigger doesn't matter. In fact, sometimes these can occur completely out of the blue. But what's common to them is, again, it's that overwhelming, sudden sense of intense anxiety. Usually a panic attack will last anywhere from 30 seconds to 20 minutes, sometimes up to an hour. But the lasting effects of a panic attack tend to be extreme fatigue afterwards, so followed by, say, 1 to 8 hours of just extreme fatigue, because your body has been overactivated and in a sense becomes exhausted after a panic attack. Again, we're talking here not about general anxiety in general situations, but that intense period of time. Sometimes people will experience 1, 2, 3, 4, 5, 10 panic attacks a day. And it can be extremely distressing. And it can also impair your ability to function. A lot of times people will avoid engaging in certain activities that they've learned to cause panic attacks. Like I said earlier, perhaps it's going to the grocery store, or going in a car to drive, or just going outside one's home. The problem with panic attacks is that they can cause increasing disability as you begin to restrict your activity more and more and more. And that's why it's important to get this treated, and get it treated as early as you can. Now, so what's going on during a panic attack? Well, there's something going on that in your life, or something that you see, or maybe it comes out of the blue, where you just feel intense anxiety, and as a response to that, your body is physiologically keyed up into a sympathetic state in which your nervous system is just essentially overactivated. And it's a bit of a vicious cycle, because you start worrying about and having anxious thoughts about the symptoms that you're having, which causes even more symptoms, which causes even more symptoms, and so on and so forth. And for people who've experienced a panic attack, it can be a very, very dreadful experience. Many times, people whose panic attacks will have them numerous times a day, as I said, and when you have recurrent and unexpected panic attacks over and over and over an extended period of time, you may have panic disorder. which is characterized by just that: recurrent and unexpected panic attacks, recurrent fears about the implications of the attack, or a fear of having future attacks in the future. So what can be done about this? Well, there's a couple things. As I've said in the other videos, one of the things you should do first is to see your family physician or your pediatrician or internist and ask them to do a medical workup to make sure there's nothing going on, in a sense, below the neck in the body that could be causing this, like a thyroid condition or a condition with your blood or an infection and so on and so forth. If nothing is found, you may want to consider psychiatric medications. Commonly, family physicians will prescribe for this, but as a psychiatrist, again, I tend to be biased and recommend that you see someone who is an expert in prescribing medications for these conditions. But sometimes family physicians are just fine in this area. There are two types of medications that tend to work best, as I mentioned before in other videos. Similar to other anxiety disorders, the SSRIs help, the selective serotonin reuptake inhibitors help, and also the SNRIs, which are the selective norepinephrine reuptake inhibitors. There are other medications like benzodiazepines, but I generally recommend against using short-acting benzodiazepines like Xanax or Ativan, as these can be very addictive and many times will cause a person to have more panic attacks over the long run. They help in the short run, they certainly relieve panic attacks, but they may cause panic disorder to get worse over the long run. I do recommend medications. I think they are quite helpful for this, but you should also strongly consider getting a form of therapy called cognitive behavioral therapy. This is an evidence-based treatment that has been shown to be extremely effective in reducing the frequency of panic attacks and sometimes eliminating panic disorder altogether. In my book, it's considered the gold standard for treatment, and it can be very effective. You only need to do this kind of therapy for anywhere between 6 to 10 sessions, and you're done. It tends to be, like I said, it's very effective. There's a strong base of evidence in the literature that supports the use of this psychotherapy, and I do highly recommend it, in addition to medications if you choose to go that route. The kinds of issues that we've discussed in this video today present a tremendous challenge for people who are suffering and for their families. If you live in the Louisville area or you are a resident of the state of Kentucky, we would be more than happy to help you in any way that we can. You can give us a call at 339-2442, or you can contact us through our website at www.louisvillepsychiatry.com. Please note, if you do not reside within the state of Kentucky, we're not able to provide medical services to you directly. If you live outside the Louisville metro area or outside the state of Kentucky, I strongly recommend that you seek out care from a board-certified psychiatrist in your area. Many times it's hard to find Christians in psychiatry, but sometimes by talking to a pastor or a friend who shares your faith, you may be able to find a competent psychiatrist who shares your faith. However, if you have to make a choice between a psychiatrist who's a Christian who doesn't have a good reputation in your community and a psychiatrist who is not a Christian but is known for his or her competency in the field, I would much rather you see a very competent psychiatrist who's not a Christian. What matters most when you're choosing doctors, what matters most is that you see someone who's competent and who knows what they're doing and who's respected in your community. I also recommend that you talk to your pastor about the kinds of issues we've discussed today, and ask your pastor for recommendations for resources for help in your community. If you are a church or an organization seeking to learn more information about mental health issues, and you live in the state of Kentucky or in the Louisville area, we'd be more than happy to provide an educational talk to your church. Just give us a call at the number I gave before or visit us on our website. I hope that this information we've provided today is helpful to you, your family, or your congregation. And I wish you the very best. The information presented in this video is intended for educational purposes only. The information provided is not intended to evaluate and/or treat a specific viewer's mental illness or emotional problem. Watching this video does not entail a doctor-patient relationship with Dr. Briscoe, Kentucky Psychiatric and Mental Health Services, or any other affiliated persons or organizations. If you feel like you may be struggling with one of the issues discussed in this video, you should contact a physician or a licensed mental health professional for a personal evaluation. The opinions expressed by Dr. Briscoe and other expert whose input is included in this video are their own and should not be assumed to reflect those of their employers, the professional organizations to which they belong, or the institutions in which they trained.